So we're looking at the sphenoid bone. This one disarticulated from the skull, and then we'll go back and show you one with the fully articulated skull.
Okay, so first we have the body of the sphenoid.
So body is the center, kind of massive part of the sphenoid.
Okay, then we have the lesser wings.
Lesser wings are going to be the more anterior and the little bit more superior of the wings.
Okay, and the greater wings.
Greater wings are going to be these deeper, wider wings that are more lateral to the lesser wings.
Okay, and then we have the pterygoid processes.
So looking at the posterior view, we get a nice aspect showing pterygoid processes.
And then the sella turcica.
Sella turcica is going to be from the superior view, right here.
Okay, and then the sphenoid sinuses.
So sphenoid sinus is going to be deep to the sella turcica. To see the entrance to the sphenoid sinus, you'd have to go through the nasal cavity at an anterior view, and we'd be going through one of these ostia right here.
Okay, and then the optic foramen.
Optic foramen is going to be very close to that. Optic foramen, also called optic canal sometimes, here, and then exiting very close to the sella turcica.
Okay, and then we have superior orbital fissure.
If you were looking into the orbit, this more superior gash that runs through the bone is superior orbital fissure.
And then we have the foramen rotundum.
Foramen rotundum, going to be easier to see from a posterior superior view, but lateral to the sella turcica on either side. Rotundum should be very round.
Okay, and then we have the foramen ovale.
As you work your way posterior and lateral, the next foramen back from foramen rotundum is foramen ovale, that nice elongated oval shape.
And lastly, we have the foramen spinosum.
Still posterior and lateral by one step, the tiny round foramen in the back of the sphenoid foramen spinosum.
And we'll have a look at these with an intact skull.
So looking at a real skull.
Okay, first we would have the body.
Okay, so just generally body is going to be here from the superior view.
Okay, then we have the lesser wings.
Lesser wing for the right side, lesser wing for the left side.
Then we have the greater wings.
Okay. Greater wings are going to be in here as they border with temporal bone.
And then we have the pterygoid processes.
Pterygoid processes, we're going to have to switch views. Get underneath here.
Okay, and then we have the sella turcica.
Okay. Sella turcica again, right there.
Okay, and then we have the sphenoid sinuses.
This might work.
Very difficult to see.
Yeah, probably difficult to see, but for now let's just say that the sphenoid sinus is going to be inferior or deep to the sella turcica right there. There's an air-filled space which could be accessed through the nasal cavity.
Okay, and then we have the optic foramen.
Okay. Optic foramen from the anterior view. And then from the interior view of the skull.
Okay. And then we have the superior orbital fissure.
Okay. So, superior orbital fissure here and there.
Okay. And then the foramen rotundum.
Foramen rotundum. Foramen ovale. Foramen spinosum.
Okay. And that's it.